Hey, Dr. Matt here. Welcome back to Sumar Health Accumulation Opportunity. Today we're talking about constipation. Nobody wants it, but a whole lot of people have it. And many people do not even realize they are constipated. And by constipated, I mean not having a bowel movement, not defecating for at least 48 hours, or not having a bowel movement every 48 hours. I think every day would be ideal, but general definition, within 48 hours having bowel movement. So I've had so many patients over the years show up and tell me their digestion is fantastic. And then when I ask, how often do you have a bowel movement? They say, once a week, maybe every 2 weeks. I'm like, wow, how long has it been this way? And they say, man, as long as I can remember, it's been this way. Is that abnormal? I didn't realize that. In many circles, bowel habits are not talked about. Totally understandable. And unless you're having pains or hemorrhoids, and that is backing you up, and you're having those symptoms, then it can seem completely normal to not talk about your bowel habits. And that would not be my first conversation to have with anybody in the first place, right? So if you haven't already subscribed, if you haven't already shared, if you liked, man, so appreciate if you do that. Just helps more people learn how to overcome constipation. And if you're in that space, you want to have all the tips and tricks, right? All right. So beyond digestive discomfort, constipation, can affect energy levels, cause brain fog. It can lower motivation, because the body is in a state of, distress. It can lead to skin issues. I even had a patient when I was doing clinical rounds in med school who would get heart palpitations when she got backed up. She's like, man, backed up, feeling anxious, heart palpitations, and literally as soon as her bowels moved, man, back to normal. So you may have had your own experience with constipation. And generally speaking, the ideal stool should be soft, easy to pass, look like a brown banana in shape, and there shouldn't be a whole lot of straining when moving your bowels. And a bowel movement really should feel, essentially like an automatic behavior, like a hands-off process. Sit on the toilet, just happens. So if this is not the case, and for many it's not, then I suggest we dive in and figure out what we can do about it. And that is what this video is all about. So many times you'll hear, just increase your water, increase your fiber intake. This will take care of your constipation. Sometimes this is true. In fact, many times it's been true. And that's all a person needs: fiber and more water. And if you are the standard American, you're eating the standard American diet, devoid of natural fibers and devoid of much water, because you're mostly consuming coffee and soda pop or other high caffeine drinks as your fluid, increasing your water intake by 30 to 40 ounces and increasing your fiber intake from whole food sources by 30 to 40 grams, this will likely do an amazing thing for you. I mean, you're gonna have a transformation both with your bowels, but just with your health in general. It's going to be like, wow, why didn't I do this before? So if you're not already doing that, great idea. Just throw it out there, get it going. Extra 30 ounces of water, extra 30 grams of fiber from your whole food substance. However, more and more, I'm seeing constipated people are experiencing not just purely a lack of hydration and stool bulk as the reason their bowels aren't moving. And the underlying mechanism is actually an autonomic or automatic response that has been thrown off kilter. And the rhythm has been completely, jostled and thrown off by anxious thoughts, worry, poor sleep hygiene, the go, go, go lifestyle, which is then accompanied by a bunch of stimulants or drugs. And top this off with, of course, the poor nutrition of a go, go, go lifestyle. I've seen this in my own practice. 10 years ago, a person was constipated. We would just, change their diet, increase their water intake. Maybe they give them a fiber supplement so they get about an extra 10 grams of fiber each day. Drink that with 60 ounces of water. Whew! Floodgates would open up, bowels are moving, everybody's happy, Such a simple, simple fix. But now that is almost never the case. And I find in the constipated space, most fiber supplements, they actually just increase bloating, they increase gas, and they really have minimal effect on a satisfying bowel movement. And studies are verifying this as well, that just fiber itself doesn't really change much as far as the consistency or the satisfaction related bowel habits. So my suggestion when it comes to bowel movements is to play the long game. I know we like our ready, now, but let's play the long game. Please don't get heated about the fact your bowels did not move today, right when you expected them to. Yelling at them will not help. In fact, it's going to hurt them. So rather, I would do the following. Number one, I would aim to decrease the number of times you snack in a day, the number of food inputs, different times during the day. Aim to give yourself, number two, a 4 to 6 hour break between meals. Like, I'm not eating food during this 4 to 6 hours to help motility. Aim, number three, to get as much fiber as you can from whole foods, like fruit, like cooked vegetables, like buckwheat, like gluten-free oats, like ground flaxseed or chia seeds that have been soaked in water and allowed to create this gelatinous structure before you consume them, like ground hemp seeds. And I would do this rather than getting supplemental fiber, because it's not just the fiber, it is the phytochemicals that build the flora and support the health of the digestive tract in these foods that are beneficial, and even more so than the fiber itself in many cases. So before each meal, take 2 minutes. Breathe deeply. Allow your parasympathetic nervous system to kick into gear, do its thing, because the rest and digest part is what we want happening when we're eating food. All right, make a point to not do on-the-go meals. Take 2 minutes in the morning. Sit on the toilet like you're expecting to have a bowel movement. If it doesn't come, no big deal. But take those 2 minutes, same time, day after day after day. It doesn't have to be this big old deal, but we're trying to train our bowels in the rhythm. Just like we've trained ourselves for years or maybe decades to race, and not have time for a bowel movement, not give our body the opportunity to have that autonomic, that automatic down push of peristaltic movements to move a bowel along. Give yourself that opportunity. All right, start exercising. In fact, a 2019 study showed that aerobic exercise demonstrated significant relief from irritable bowel syndrome related constipation. So a hard run literally is one of the best antidotes for constipation. Hard run just feels great, right? But it actually stimulates the contractions of our intestinal tract, as well as just the overall jostling effect. And this run, there's also these specialized hormones and digestive enzymes that are secreted into your digestive tract, promoting peristaltic movements, promoting a bowel movement when you are running. And this can enhance motility. So if you haven't started running, man, what a day to start running. All right, finally, number 8, dates and prunes. These are fantastic. They both create this gel-like substance that softens the stool and promotes bulk to the stool, but they also feed your beneficial flora, making it much more likely that your bowels will function better in the future. This is called playing the long game. This is not just like Miralax, bowel movement, Miralax, bowel movement, Miralax, bowel movement. No, this is playing the long game. What's making our bowels healthier while also causing them to move. So there was a 3-week study showing that eating 7 dates significantly increased bowel movement frequency in constipated individuals. But that was not all. I mean, it's awesome. We want to move the bowels, but there's also a huge reduction in stool ammonia levels, concentrations. And ammonia is associated with intestinal inflammation, irritation. So if we get too much of that, the intestines get really ticked off, and they usually don't move too well when they're ticked off. And there was also a decrease in DNA damage of the intestinal lining. It's pretty wild, right? Just 7 dates a day for 3 weeks, and so much benefit was obtained. On top of the fact that the bowels were actually moving more consistently. So consider giving these 8 a go and let me know if they work for you. If they don't work for you, let me know that too. I would love to hear your story. I've had so many patients over the years who are just insanely constipated, and we've had to go to great lengths. But for so many of us, that's like the 1%ers. 99% of us, we do these things. Bowels are going to move, life's going to be great, and we are literally creating a more wholesome, healthy, vital gastrointestinal tract. All right, I'm Dr. Matt. Hope you guys have a fantastic week. I'll see you next time.